So, Dr. Zymantas, you do see children, and there's this thing called sealants. When should children have sealants? Do they need it? Do children need sealants on their first teeth only, or also on their second teeth, which are the permanent ones, as they become teenagers? And how long do they last? Are they really protecting the tooth as well as they should? Tell us.
The first sealants patients should get, and everybody has different, their own pretty much personal guidelines. The first sealants that we place in our office are on first molars, which come out about 6 years old. And then we primarily just seal children's molars. So you get a set of molars at about 6 years old, and then you get another set at the age of 12. So say when a kid is 6 years old, then we place four sealants on 4 teeth. And what the sealants do is that they protect the tooth, because those teeth usually have deeper grooves. It's kind of like the cracks in a highway, and you see the workers filling up the cracks in the highway with tar so that the crack doesn't get bigger. Well, this is kind of a little bit comparable, where we have many fissures in the biting surface of the tooth, and that's usually the primary surface where the decay starts, because bacteria and food particles, something sticky, may get trapped inside of the groove, and then that's how you start decay. So if you can seal that off and make it so that the surface is impenetrable to the bacteria, and the food will not lodge and stick around inside of the groove, then that's the ideal situation. And sealants will probably last about 10 to 12 years or something like that. It's just a very thin layer of tooth-colored material that's injected over the top of the tooth and cured with a special light. And that will significantly reduce the chance of developing a decay in the future. But nevertheless, children have to still brush and floss their teeth like normal, because there are still 5 or 4 other surfaces that can still get decayed. And on a rare occasion, even surfaces that were sealed off, if there is so much bacteria on there, then it can even penetrate through the adjoining area of the sealant in the tooth and create problems there.
Right. And of course there's the gums, which is a big reason why we clean our teeth. We're not only just cleaning the teeth, but we also, getting the gums going. So let me ask you, children who have sealants, should they be paying attention to how and what foods they eat? Not really. They don't do anyway. If you tell them, that would make, take away all the pleasures from whatever it may be, chewing things, biting on hard things or so. Are you giving them any recommendation there?
Yeah, we don't really talk too much about biting hard things. Most people know how much force to more or less use when they're chewing on things, so that's usually not an issue. The biggest issue and the worst issue is the amount of sugar consumption by kids nowadays, especially soda pop. I forget, back in 1950 or something, I think the average consumption was like half a can a day, and now it's up to like 4 cans of pop a day. That's huge amount. Say in a can of Coca-Cola, there's about a 12-ounce can has something like 10 teaspoons of sugar, which is incredible. And so a kid that's using, or even also like Gatorade, anything with high sugar content, if the kids are chewing it or using it for a long period of time and just sipping, then the acid that the bacteria are producing is almost constant. And many kids I have, especially athletic kids who drink a lot of Gatorade throughout the course of their activities, they get a lot of decay too, because they're just sipping, and all that acid attack softens up the teeth, and then it will create decay if it's prolonged. It will definitely soften the teeth, and when they brush, they kind of microscopically erode some of the teeth as well. So the worst thing we see is sugar intake through the soda pop. Sugar in itself is bad, but we recommend patients to use some kind of sugarless gum to have handy if they do use any kind of sugar material because the sugarless gum, chewing it will activate their salivary glands a little bit more. It will create more saliva and kind of flush away the acid a little bit better. And the mechanical scrubbing with the gum, that also helps a little bit in cleaning off some of the gunk that builds up on the teeth themselves.
Got it. But that what you just said has little or nothing to do whether a person has sealants on it or not. He should just do that or not do that anyway, right?
Correct. Yes. It doesn't matter if you got sealants or not. Again, the most destructive thing I see for children is use of soda pop.
Okay. So no real special instruction for a person who has sealants. A little bit like, a person who has braces, he gets a few little special instructions on how to take care of them, but with sealants, not really.
Correct. They can, normal activity pretty much, there's really no limitation to any kind of activity. So, you put them on, it's indistinguishable, the patients aren't even aware of it, and it's just like a force shield that's protecting the teeth.
Okay. Well, thanks a lot.